Welcome to Tailboard Talk with
Chris Rasmussen,
Craig Nelson, and Jeff Wallin. Every month we explore different topics of interest to you, our cohorts in fire and emergency services. So whether you sit back and listen, sound off on the message board, or call in live to be part of the conversation, we welcome you to join us in our mission to improve the fire service for those we serve and those we serve beside. Now coming to you live from the Great White North, this is Tailboard Talk on Fire Engineering Talk Radio.
Hey, welcome to Tailboard Talk for March 29th, 2024. This is Jeff.
This is Craig.
And Chris.
So, it wouldn't be a Tailboard Talk show without talking about the weather. It means so much to all of our listeners. I know they'd be devoid of finding out what's going on in the Great White North here. And actually today, it's back to being Great White and North.
Cold and windy.
Yeah, so as we're recording this ahead of time, there's a bunch of snow on the ground and snow blowing around and a storm that was supposed to be much worse than it actually ended up being, which I'm fine with. But we went from just about looking like spring. You guys have any of your grass starting to green up, like right around the house where it was getting?
No.
Okay. I'm going to try to be the source of positive energy for this show.
Yeah, things started actually blooming.
Maybe.
And then now it's dead.
Yeah.
It's kind of sad, but
everything's dead. There's no hope for the future.
But by Friday, we should be back. We should be right back into
I think so.
the spring of things.
It's been a nice mild winter, very little bit of snow, but right now it looks all of that on the way over, and the roads were snow compacted and snow compacted and all crappy and stuff like that.
Yeah. If you don't like the weather, just wait a couple minutes.
It's bound to change. Yeah.
So how you guys been? It's been obviously a month. Everything going okay, Jeff?
It has, yeah. It has been a month, and I know we're going to announce this at the end of the show, but we might as we're bound to lose a couple of people as we go. So maybe right up front, we should say that there's a new schedule for the podcasts on Fire Engineering Talk Radio, and we'll be settling into a regular schedule now of having our show post every third Friday of the month. And so you can mark that date on your calendars, push all the date nights away from that night, so you can tune in right away, download the podcast, listen right away. In fact, that could be a great date night, I think. If you got that special someone with you, throw a frozen pizza in the oven and, head over to the YouTube page and watch us on video too. Nothing
sounds pretty romantic.
Nothing would spark the romance more than watching us.
Looks like we've got the prime time spot though, Friday night.
Absolutely.
Pretty locked in there.
Absolutely. Good thing we're on early enough. We're not really competing with Blue Bloods, so we got something going for us.
I won't take the time for you to explain to the listeners what that is. Regular television, Jeff? I'm not sure that.
Well, it's what we've been watching in our house ever since they canceled Murder, She Wrote. So,
So far, he's captured all the older listeners with the weather and Blue Bloods.
Yeah, there we go.
I've not looked at the demographics for the show. I know how many people listen. I just don't know what their story is.
Well, you've got to touch a couple of them out of the thousands that listen. So,
well, people have been saying I've been touched for years now. So, all right. However, we can make some connections, I guess. Speaking of making connections in new ways in the community, tonight we're going to be talking about a newer concept around the state of Minnesota and eastern North Dakota, and that's community health alliances, a way to try to get in and make connections with people who are perhaps being a little bit underserved as our customer base. Some might refer to them in the past as like our frequent customers that we're going to over and over again. But I don't want to get too much into the content of where we're going till we bring our guests on board. So we've got two people joining us tonight. First of all, we've got Amy Lucht. She is got 30 years of healthcare experience in various systems around the Twin Cities area and being on different boards and committees and work groups trying to improve healthcare services in her area. She is the founder of Care Resource Connection and the co-founder of the Community Health Alliance. And so, Amy, we'll introduce you first. How are you doing?
I'm great, Jeff. How are you? Hi, Chris and Craig.
hello.
Hey, Amy.
Great, thanks. Good to have you on. And also joining us is Steve Koering. He's a 34-year veteran of the fire service. He served on several different fire service organizations and committees and initiatives around the Twin Cities area. And he's currently serving as the chief of the St. Louis Park Fire Department, a suburb in the Twin Cities, and co-founder of the Community Health Alliance. Welcome, Steve.
Good evening, guys. Thanks for having us on board. Looking forward to telling our story. And I appreciate at least 6 sets of ears to listen to
it. Yeah, thank you both for joining us.
Absolutely.
Yeah, and depending on how many times you go back and download the episode, those numbers will just keep creeping up and up and up.
We need your help, Steve.
Most of my relatives have died by this point, so I got to reach out to a different demographics.
Well, Steve, maybe to begin with, the initiative we're going to talk about started around the St. Louis Park Fire Department. So maybe you could just describe your department, where you're at, kind of what makes St. Louis Park the way that it is for listeners.
Thanks. I appreciate that. Yeah, we're St. Louis Park Fire Department sits right there. It's on the western border of Minneapolis. So we're a first ring suburb of Minneapolis. It's about 50,000 people, just a hair over 50. The fire department is an all-career department. We run a standard A, B, C shift schedule. We have 24/7. We have about 35 staff overall, that from command staff down through the ranks, and we have an all-hazard response. We do respond to all EMS calls in the community, but we're basically an EMS first responder. The transport component of our system is handled by Hennepin EMS, which is they have the primary service area control for our area. And so because of our location and because of the demographics, if you look up St. Louis Park and you look at the demographics, we have the demographics are very senior in nature. So we have a lot of senior population there, an aging population. Set to a senior population of over 65 is set to double by 2030. We have a number of skilled nursing and assisted living and independent living senior facilities, as well as a number of kind of mixed use 55 and older buildings that are also going up in our community to kind of address this need that's happening in the community for housing for seniors. And then along with that, of course, comes the increased demand for services, including healthcare, EMS, and ultimately then 911. So when I came to St. Louis Park 10 years ago as the chief, I was kind of working under this guide of where were we going to go with the Affordable Care Act. So in 2015, we were looking at all these really strong kind of movements of the Affordable Care Act that was supposedly going to essentially create the need for less 911 response, less ambulances, and more kind of in-home care where people would not be transported to hospitals. They'd actually be cared for in their homes. You're imagining Dr. Welby, with his little black bag coming to your house and sitting down with you across next to your bed and kind of giving you that pill and whatever. Well, none of that, of course, materialized with the Affordable Care Act. But one of the pressing things that came out of that discussion is that for fire departments that were really heavily engaged in EMS, then you would ask yourself, then what is the validity or the relevance of that fire department? If you remove 50% or more of their call volume because people are going to be doing something different, then how does that fire department essentially create value for themselves in the community? And so I began to look at things differently where I say, well, instead of meeting them in the 911 environment, why don't we start taking a look at them pre-911, start focusing on how are they accessing the system, how are they coming out of the hospital in that discharge environment, transitional care units, how is that happening in our community? And what we uncovered was that there's a tremendous disconnect between the healthcare system and the patient, and then all of these community-based resources who are all kind of stacked up like cordwood wanting to help with no real direction, structure, or process by which to do that. And that frustration, of course, led me to meet Amy Lucht. And Amy, who I met in another meeting where we were talking to a different healthcare system, she listened to what we had to say. It immediately resonated with her, and she connected with me a few months later. I will say, as we get into this discussion, for listeners on this podcast, I'm a firm believer that the fire chief is the community risk reduction specialist in the community. Nobody owns community risk reduction more than the fire department, and the fire chief in turn then owns that. And I think that because we're the most trusted resource, and that's statistically proven in a number of surveys, that the firefighters are one of the most trusted resources in the community. When you couple that trust with the responsibility of this community risk reduction discussion, then you really have nowhere to go but to think about how to partner with the fire department. And when you make that partnership happen through this alliance, it's really immeasurable, the benefits that you can bring to the community in a way that nobody else is doing in your area. So that's kind of where we're at with St. Louis Park. I'd love to hear Amy's perspective on that, and I'll turn it over to you guys.
Yeah, so Amy, for the audience, why don't you explain a little bit about Care Resource Connections, what they do now, and then we can kind of get into the story about how this actually developed between the two of you in St. Louis Park.
Yeah, thank you, Jeff. So again, my name is Amy Lucht, and I'm the CEO of Care Resource Connection. And our organization is a 501c3 charitable organization that was developed and designed to partner with fire departments. And so what we do is we create bridges that are needed in the community, and we fill those gaps with 911 call referrals. So after the 911 calls when we come in. And so what we do is we're able to connect with that caller and meet them where they are. And by looking at healthcare in a flipped manner, we start with the patient first, and then we work our way back to the care team, and then we fill in the gaps there. So when you think of Care Resource Connection, I want you to think of how we address the social determinants of health, leading with the fire department, and then ultimately bringing back the integration of the care team.
So how does all that translate into what's been what took 5 to 7 years to develop in St. Louis Park between the two of you?
So like the chief stated, when I first met him at another healthcare organization, we have healthcare is built in a specific way that's designed to have the patient meet them where they are. And when we spoke and I heard about what they were trying to do with a group of chiefs, we sat down and we thought about how we really need to start in meeting the patient where they are. We tested it. We've tried it. We've had multiple iterations of making sure the crew is engaged and how we can do this. But everything starts with the fire department, and it starts with the crews. The crew, they're the ones that are out in the community, getting that spidey sense in their gut when they know that they're going to be in a situation where that person may need some help, or have been there before, and they know before they leave, most likely they're going to be called again. And having that conversation with the chief about how the fire department owns this, because many times they'll come into a situation and they may not want to get transported someplace, but they'll share everything, like he said, with that most trusted resource in the community, in the fire department, in their home. And so it's that moment where we're able to look at this as a community risk reduction effort and look at the community health in a whole as a community, as each of them are unique in their own space. But we wanted to build this in St. Louis Park and then work through so we could scale it to the rest of the state. And then I'll let our nationally recognized expert, fire chief on community health, Chief Koering, talk about how we describe this.
So, yeah, thanks, Amy. I think nationally recognized. I think that we have, because it does start, for those of you who are, Craig and Chris, I don't know if you're firefighters also, but If you are, then you've sat around the table at the station talking about and wondering about who was going to do something, right? That patient, the high utilizer of 911, come back from that second, third, fourth, fifth, or more run to that same address for the same problem with no real results. And everybody sits around the table going, when is somebody going to do something? Somebody needs to reach out. And our approach has really been, if not us, then who, right? So we took ownership of it, and that's kind of how we approached it. The firefighters, you would say, well, that's just more duties as assigned, chief. When are you going to, what do you want us to do next, right? But the reality is that each of them know that we rely on their spider senses, if you will, to pick up that potential high utilization patient. It could be on the first call. It doesn't have to be on the sixth call. They're smart. They're attuned to what's happening in that house, and they know that we're going to be back there again. Once they see that and they put that referral into the system, then that referral comes back into the care coordination world, a care coordinator that we have on staff at the fire department. And essentially from that time on, all of the opportunities are opened up for that patient, with their care team being made aware of what's happening, community resources that are attached to that care team or assigned by that care team. Everybody's working in a coordinated way to bring an improvement or a quality of life improvement for that patient. And I can tell you without any reservation that once those resources are connected and that referral takes place, it's generally 911 stops happening for that patient. So we have numerous patients who are 15, 20, 30 times a month calling 911 who go from that many times to zero. And it's just because they're connected to a resource and have the ability to stay connected to their care team in a way that they weren't before. And that's incredibly important. And as our communities diversify more, and you have all these unique inequities happening within communities within our community and how they access healthcare and how healthcare addresses their needs, this now creates a way for you to really meet them where they live and actually help them navigate healthcare with those community-based resources, which are aligned with them specifically to meet their needs, thus lowering the demand on the system and improving equity and inclusion in your community.
All right. So crew that's out in the field runs across a person that they feel needs greater help or assistance. And I'm guessing that a lot of departments across the country have had experience with finding somebody that is having problems taking care of themselves in their home, needs some type of help, and maybe they've made a referral to their public health department or filled out some type of form. And our experience in Moorhead was you can do that, and sometimes people get some kind of help. Sometimes it takes a week or two to get an email back from the public health department to ask, what's the story with so-and-so? And yes, we'll check into it and we'll get back to you. And maybe it takes another month before you hear back from the county health department about maybe what they found before you're even trying to address the issue. So the question I have for you is, what makes this different? What makes this successful? If there's already resources there, I guess, I'm not sure what all is available to people, but it just doesn't seem like when you refer somebody to a government agency that anything seems to happen.
Happy to help. Yeah, for sure. And that's kind of at the root of why I founded Care Resource Connection. While public health has a great, vast variety of resources and connecting, there's a process. There's a limited capacity of case managers that are managing several clients, and the need just continues to grow, and they're asked to do more and more with less and less, like all of us are. So the way that this program is successful and the way it's different in how it works is it's from within the fire department. Let me just start there. I can't stress how important it is for the crews and the entire fire department to understand the power that they have, that everything starts with them. It starts with the 911 call. And so when you're getting back and you're getting that referral in to whomever that point person is, the first thing that we do when meeting the patient where they are in this program is we look at all of their social determinants of health. obviously we understand this is the reason for the call. Maybe they had fallen, but we go a little bit deeper. And the discovery forms that we designed with Care Resource Connection, because I, as a case manager, I used to do this work. I purposely designed our visits to take away that first initial intake from public health. So when we do our assessment, we have literally collected all the data, all the information that public health is going to need to come in once we hand it off. If we're looking for specific programs, that first visit's already done. Now, when we engage them, they're coming in to actually provide what's available to the client. So we shave off that first 30 days. So that's why we're able to come in and we are able to look at, not only is it a fall situation, we ask about, their chronic health. We ask about how they're managing their medications. Are they understanding how to use them? Are they able to afford how they're using them? Does it work within their lifestyle? We get into our promise survey where we really look into parts of the getting into early onset dementia and mental health, sleep, what they're eating. I mean, that whole social piece. I believe that healthcare is how we live our lives every day. Sick care is when you're connecting to your care team, and the Community Health Alliance is about connecting to social care. And when all three of those are brought together, public health can come in, and there's this great synergy between where we're boots on the ground bringing this information to them, and we've identified the needs, and we connect it to the care team. We're able to send it to public health and to the care team. On the flip side, we also hold that team accountable. So they're coming in with the referral. We're gathering the information. The fire department does not need to worry about, going in and doing assessments. All they need to do is ask a simple question. Are you open and willing to accept help? They say yes. We take it from there. Care coordination comes in, schedules a home visit. We meet them where they are in their home, and it's a completely different environment when you're in that moment of a 911 call. So now you get to see how the patient is living, what their environment is, who their caregivers are, their families. And many times these folks are alone, or they're just afraid, or whatever the case may be. But we're there as the fire department coming in, and they share with us more than they'll share with anybody. And it's that trust that allows us to come back and connect with them 30, 60, 90, 120 days or longer if they need that.
So it's not just a one and done. You come in, you connect them to a resource, and then we step away and everything's good. We're with them for a while longer?
Correct. And we make sure that the people that we are connecting them to have made that connection, because we make sure we follow up with them. And they tell us when they're ready to kind of step away, be it home care or some other service. And as certain services step away, then we want to make sure we're coming in, and are they okay? So maybe it was a fall and we brought in a PTOT to do a fall assessment, because Medicare covers those, and they get this free assessment from a physical therapist. The doctor signs off on it, and then they may only have 14 visits because Medicare only covers so many. And then once that physical therapist is ready to discharge the team, they come back and let us know. And then we go back to the resident, which has been about, that 30-day check-in point. And we ask, how do you feel? Are you confident in where you are right now? Do you feel like you would need something more support to help you age in place safely longer? And then we connect back to the care team, because people don't see about, why do I want to go to the doctor and talk about what I've just lost when they already came in and they helped me? I don't want to be a bother, but I think I can manage this on their own. And we're human. We're going to default to our same patterns, and they just need to make sure that they have those systems in place so they're able to say, yep, I think I'm good. Or now I have somebody that can come in and maybe come do my laundry because I can't do stairs.
So I know we'll talk about more head story in this in just a little bit, but this sounds like an awful lot of work, and it sounds like an awful lot of knowledge that needs to be there. So as a firefighter or a fire captain with my crew, I mean, this idea sounds really intimidating, and it sounds like it's going to add a huge extra workload to the crews. And I know that's a common fear. So
Sure.
is that how it works?
Well, let me step in real quick and address that. I'd say it's like anything, right? So when you sign up for something new, there's always a learning curve. There's always this process that has to take place. Maybe you've been using paper in the field and now you're going to use an iPad. Maybe it's whatever those things are, right? These are not insurmountable issues to work over, and as they always talk about how the fire service, the only thing consistent in the fire service is the lack of the desire for change, right? Which I disagree with, because I've seen firefighters at all levels change through miraculous challenges. And I think that, once you tell the firefighters and work with the firefighters and how to do this process, they find out how easy it is. This is really no extra work at all. In fact, it's saving them. I can tell you, for instance, in the today, year over year call volume in our fire department has dropped by 2,000 calls per year. Now, if you tell your firefighters that you're not getting out of bed at 2 a.m. Or 3 a.m. to go pick up Mrs. Jones off the floor or Steve off the floor, or you're not going back to that same person only to be, met at the door with the medics who go, "Why are you here?" I mean, those are the things that just chip away at the morale and the compassion fatigue of our firefighters. And so this supports and enables that to be eliminated. I think an important component of all of this is that our firefighters have the compassion and empathy. They want to see what's best for the patient. This is a very patient-centered idea, which I think our firefighters think that way. And so because it's patient-centered, I think it really resonates well with them. And our union, my union president will stand up and say, without a doubt, that this has made one of the biggest impacts on the morale and the energy of our fire department is this work that we're doing in community health. And our union and our firefighters support it wholeheartedly. And I'm guessing that the Moorhead Fire Department is going to experience the same positive impacts once the system is up and running at full tilt there.
And I think that's always the fear, right? Is all you have to do is just ask a simple question. Are you open and willing to accept help? Trust your gut, which they're already doing. So, and then they just hand it off. Just hand it on off to your point person. And then that's what the alliance is for. And then we take it from there. And then once the crews start seeing the referrals come in and those calls start coming in, and then they're like, "Hey, what happened to Amy? Did anybody, get connected to Amy?" They're not having those conversations. Now they're like, "Oh yeah, Amy's good. We just saw her the other day." And it's all because of the fire department.
Okay, so it doesn't require all the firefighters and captains to become specialists as
No.
social health care workers, learning what all is available to the customer. They're not the ones doing the actual connecting to the services, but they're they're identifying a person in need, doing the referral, and then we've got some people in the background that are doing that work to follow through and actually make sure that a plan is developed and followed through that makes an impact in our customers' day-to-day lives. And basically,
yeah, in our system, Jeff, that's as simple as checking a box on the EMS report. That's all. I mean, it's that simple. Just check a box that says this patient should be referred into the community health program, and then Amy and the care coordinators take it from there.
I think that's a pretty great idea. I work still on the shift, and I hear the guys come back from calls, and they're talking about compassion fatigue. I think you said that was a great term, Chief. They really do want to help people, but they are tired of going there 30 times and not getting any help, or waiting 2 months for the help to come. And then I think that's a great deal. But I just want to make sure we're all on the same page. Your fire department hired somebody to sit and handle these situations, or is it run through Amy in the group, or is it how does that work? But when I check the box, who deals with it?
When you check the box,
Amy describe what happens in Moorhead.
Yeah, so when you check the box in Moorhead, it's going to come to me and my team. You have a designated, you have a community risk reduction officer, Mike, at Moorhead, who the referrals will go to. Mike will send them to me and my team, and you have a dedicated care coordinator on the back end working all the referrals. And that's how it's working up in that way. And in where we are in St. Louis Park, we were able to be lucky enough to get a grant for our Community Health Alliance to bring Tanya on board full time for 3 years. And that was through a health system that we partnered with and who believe in this program. And so thankfully we had Tanya. She was my assistant for over 10 years, and I brought her on as the first one. And the crews and Tanya is doing a great job. And that's the goal. Like I said, when I was in Moorhead, the goal is to get this program up and running, bring your community together, and then you start looking at the impact you're making. And then that's when the community comes in and you have every opportunity to say, we need to be able to have this. I'll bring interns in, we'll build it, but we just have to bring your community together to get so you can get a care coordinator.
The mission from day one has been to make this scalable across the country, certainly within the state of Minnesota. And so everything we do in St. Louis Park takes on a different edge to it because it's really the incubator by which we bring all these ideas, this nuances into that. And so we test it. It takes a little more energy and staffing on our side because we're actually using those staff to go out and work with these other departments who are testing this kind of thing. But everything has to work and be successful in our system before we then come out to cities like Moorhead and say, here's something you should add to your toolkit. It has to be tested and kind of fire tested from day one.
Sure.
And so, Amy, if you've been successful at getting at least one healthcare system to buy into this funding, they must be seeing, I'm guessing, two things, both a reduction in cost for that to be worthwhile, but also be an improvement in patient outcomes or quality of life in their homes to say that the costs are definitely worth it. They've got to be seeing good results to actually stand behind it with some funding. And I understand you're also pursuing other grant opportunities from people who are seeing that this is actually making a huge difference in people's lives and is a lot more efficient at doing this than what's in place right now.
That is correct. We work with the Governor's Board on Aging. AARP is a partner of ours. And so there's tons of grants, truly, that come to me all the time. And like I tell the chief at St. Louis Park, and we'll have conversations in your community about once we start identifying where the actual need is, which I believe we have already in the short time that we've been there, now we can start coming in and taking that data and bringing the people to the table that are the stakeholders and that are the decision makers that can help us kind of shape and move some of these things.
Yeah, I would say, Jeff, and to answer another side of that question, for fire chiefs who are listening to your podcast, which I'm sure there are hundreds that are asking the question, well, that's not how it works in my area, right? So I will tell you that the fire chief who waits to be reimbursed for this work is going to grow old and tired waiting for it to happen. I think you have to really do this because it's the right thing to do with the community, and the community sees it as a value to its residents and reducing risk and improving equity and access. And know that with that will come these value-based kind of discussions that can occur with the healthcare setting once you come in and prove your validity and relevance within that community. And the system that we've built will help you do that. But up front, it's going to be, why are firefighters doing that? Help me understand that again. And no matter how successful we are, there's always that adoption process. And for city leaders who support their fire chiefs to do this work, they will benefit greatly from the increased brand recognition of that community and how it treats its residents.
Yeah, and I can say on that compassion fatigue piece, I think that's, going out multiple times a night on calls for people working on shift work isn't necessarily a problem if it feels like you're making a difference and you're out there for a good reason. Right. But when you leave somebody's home and you know you're coming back and you know nothing is going to change, it's not just that I feel like my time was wasted because I went on this call, but I feel like I took this job to make a difference and to make people's lives better. and we should be doing that, and it's not happening at these calls. And I don't think most of us realize that up front. We just know that, we're going out to this place again. But realizing that it just kind of tears a little piece of your soul away to know that there's got to be something better than this, and there's not. And it transforms what seems like a sense of helplessness, both for them and for us, to where, hey, now we're walking away, we're making it better, and we're following up so that we actually do see a change. And we can see their life improving for the better, which is really why we got into this business in the first place, not just to stop pain, but to get people on a road to recovery or independence, dignity and esteem. And those are a lot of the things that I have heard from others are happening, and we're brand new in this process. So I've only seen just a couple examples yet that maybe we'll get into. So I'm wondering, you spent a lot of years trying a few different things and tweaking some things to make sure things were right in St. Louis Park. How did this expand outside of the city? What were the kind of those first steps that brought some other departments on board?
I think a lot of it was, like I said, the communities knowing what we're doing and doing the classes that Steve and I have gone and where I met you, like up in Duluth, Jeff. And it just organically happened, right? So as communities were coming on board and as the public health and the grants were becoming available, it was strategic in my effort because I knew what fire departments were ready or wanted this. And Steve and I talked about where we should go and what steps we should take. And I wanted to have something on both sides of the river, just so we could have some data to compare things to. And it was really important to have rural included as well. And so the way that we've been expanding it has been strategic, but it's also been, I think I have 12 more fire departments on a wait list as we're getting ready to onboard, another 8 after you guys. So it's really all about who's looking at this work as this is something that we really want to dive into because we want to look at it as, a quality of life measure that we really are committed to here. And then looking at it to see kind of where things were. And I think the expansion really started to go beyond St. Louis Park when we got the Park Nicollet Foundation grant, and then we brought in Hopkins. And so we were able to kind of look and see, now we have 2 communities, next to each other, both with, different needs, but we're able to now to start, taking that little hub of St. Louis Park, Hopkins, Minnetonka, and then the goal is to really start creating these maps of data for us to really start having a true community needs assessment done.
Yeah, I think if you think about how fire chiefs think, nobody's looking to add more to their daily workload, right? They're not, let's go out and try something totally new today, right? With no proven basis that it's going to work. I think that people have been watching us for the past 8 years, and I don't know if you ever saw that YouTube video, the guy dancing on the hill, and eventually everybody joins him on the hill, right? That guy, that was me. Dancing on the hill. And
who was your first follower then? Who was the next person who started dancing next to you on that hill? If you haven't look up first follower if you haven't watched the video.
If I would say Amy happened to be at the same concert, she showed up on the hill with me. So it was the 2 of us, and has been the 2 of us for a long time. But I think that ultimately we have people have been waiting for us to kind of break through and create this toolkit, and to make it easy for people to step into this discussion in a way that before was very complex and beyond comprehension if they were trying to defend it for their staff. So it's much easier now. It really is fairly turnkey, and all of you should feel really, really comfortable knowing that you can walk into this in a very comfortable, paced way and start to do the work that the Alliance is doing.
So I feel feel like I'm dominating the questions here, but so West Fargo Fire Department in North Dakota is about 250 miles away from y'all. How did it take a leap from the Twin Cities out to North Dakota? A fair drive away. That doesn't seem like a natural next jump after a few of your, neighboring cities and chiefs that know each other have gotten along. So how did that connection start?
That's a different YouTube video, Jeff. But essentially, we were featured on YouTube. I can't remember what the story was, but there was a YouTube video done about the work we were doing in St. Louis Park, and those guys up in West Fargo saw the video and gave us a call, and the rest is history. Amy connected with them and helped them kind of get things rolling, and we did a meeting up there. And I can tell you, where you sit up there, I mean, you have an amazing plethora of community-based resources and a healthcare system who are on board with this concept. And I'm thinking there's going to be some amazing things that come out of that area with the Community Health Alliance.
Sounds good. And actually moving into Moorhead, our mayor was at an elder care conference or a meeting connected with some of the work she does. And I believe Amy was a guest speaker at that meeting to talk about some of that work and how it's been impacting seniors in the community. And she was the one who made the connection for me to say, have you heard about this group and what's going on? I'd like you to check it out because I'm really excited about this. And I think we need to commit some resources to doing this in the city of Moorhead. And our mayor is pretty well beloved by a lot of folks, and she's active in a lot of different causes and groups of people who really need services and so forth. And I happened to look and notice that you two were talking at one of the Minnesota State Fire Chiefs conferences in Duluth. Like I said, we made the initial connection, but also discovered the YouTube resources that I don't know if it's YouTube, but the podcast resources that you had available at the time. And this was close to a year and a half ago, and started trying to learn more about the program on the way down, knowing that, hey, I was going to be needing to follow up with a conversation with y'all. And so I can say from the moment we decided that we think this is something for us in our future, without having a long waiting list at the time, it still took us about a year to kind of get some of the moving pieces in place and to get our management team on board with the idea of what we like to explore and see if we can institute this before we were ready to get started. So for Moorhead, I can say that we officially started the program, and by that meaning we had our first contact with a human being a week ago Thursday from this date that we're recording. So we're not even 2 weeks into providing live resources as scared but trusting individuals to say where this is going. And I'm thinking the closer you are to doing this, the way less scared you are and the more really excited you are about how this whole process works. So we've done team training with our crews last week. Was it just last week, Amy?
Yeah, last week I was up there. Mm-hmm.
It seems like it was either last week or a month ago, the way time flies with it. But I guess I'd like to just share one story, keeping names out of it, that goes to cement this. And we had an individual at a larger apartment building that is somebody that a lot of our folks know, and we've been to more than just once. And we know that person has some needs that are being unmet and frequently has to call for our services. And the reason doesn't particularly matter why. But we did a first contact with that person through this program. And so our person, Mike, went out with Amy while she was in town to help walk through how this works. And there were a couple things that surprised me from the story that I heard when I got back. When you guys got back, I wasn't out there. And one of them was that this person didn't, a few of the resources that might be available to help her were kind of walked through and explained to her. And she was surprised, maybe shocked is probably the better word, that there were the kinds of resources the community had available to help her. And she was completely unaware that some of those resources were there, and not just an ER or maybe a physical therapy program, but there are other resources that could help her kind of regain her independence. And She had been basically living on her own in this bigger apartment building. The second thing that shocked me is for a lot of people who are trying to manage through these problems is, Amy, you described that their world ends up shrinking and shrinking and shrinking, that they're able to do less and less. They don't feel comfortable going outside of their home, or can no longer drive, or don't have physical stability to travel outside of their apartment, or where they've got hand reach to countertops and other things like that. And I didn't realize that your whole world could be you and a couple pets in your apartment, and you don't feel safe or comfortable or confident enough to ask other people what's there, to think there is anything there, or to think that anybody else frankly cares, whether it's family or responders. I hadn't considered that before, that idea of your world shrinking down. And as she was connected to just a couple of the resources before they'd even gotten started, that she was just expressing a huge joy and thankfulness to the firefighters to follow up with her. She didn't call us. We stopped in and visited her, which she was floored by, that she got a phone call, first of all, just even getting a phone call from us, let alone somebody coming into her apartment and trying to find out what her real background needs are. Because the reason that you might have gone that day, I don't know what it was, and that doesn't matter. It might have been for a fall or a lift assist or feeling dizzy or sick. I don't know what it was. But oftentimes that's just a symptom of what's really going on, what's really debilitating their life. And you can go to the ER and they'll talk about what happened that event, and you're discharged and you go home, and that might be the very end of it. And the connections aren't made between what are all the lifestyle issues, or what are all the signs and symptoms. We've only got a few medical ones. What are all the signs and symptoms leading to what's going on? And can be a mixture of the care and the support they're getting from the landlord at the building that they're at, and the support they're getting from in-care health assistance that isn't truly following up on all the things, that are just kind of going through the motions. And it's so easy for all the service agencies to just end up going through the motions with how many people they have to see and what they have to do. And what I saw was a coordination of these things, and asking the questions of, why are we having issues with this medication administration when there's supposed to be assistance? Or why do we have torn carpeting at the carpet strip between the hallway and the kitchen for a person who's having mobility and stability issues, and that's a tripping hazard? These medications they're getting indicates an underlying problem that nobody's talking about, that's obviously there and could also be causing her calls for assistance. And we're only half a step away from pulling all those little loose pieces together to giving her a better quality of life and stability enough to start managing the things on her own that she doesn't feel safe and comfortable doing. And I was blown away from that, and the story doesn't stop, because now I'm on an excited roll about this whole thing. But she ended up sharing with you, Amy, and Mike while she was there that you'd notice that maybe the housekeeping in her small apartment wasn't the best that it could be. And she said, well, it used to be better. I know I'm paraphrasing, but her vacuum cleaner broke, and she really couldn't do that. Maybe she had help occasionally from somebody else, but she couldn't afford a vacuum cleaner. It's literally between a vacuum cleaner or food, let alone does she even feel comfortable, if she had the money, to go to a Target or to shop online for a vacuum cleaner, or even assemble it, when she doesn't have any of those resources to make that happen, or anybody to lean on. And when you came back to tell our staff about the story during our staff training, I saw more than one person either ask you or talk to somebody else next to them, let me know if they don't get that vacuum cleaner thing figured out. Just that little quiet whisper in that, gosh, I can chip in some money to get her a vacuum cleaner if that's what it takes. And nothing against our folks or any other fire department's folks at all, but you go from saying, we're going out on her again because you're not going to make a difference, to I'm willing to dig in my pocket if I think that could change what's going on for her. And that's regardless of whether we keep coming to her house again or not. But I didn't realize she had that need going on in the background. I just take it for granted. I'll go buy 2 vacuum cleaners a year if they break at home or whatever, not even think about it. But to know that she feels she just can't. It's not even an option for her to replace the vacuum cleaner. Once it's gone, she's done. She's got no option to clean anymore, and no hope to ever be able to regain that. And some monies were found to buy a vacuum cleaner and bring it to her. And I haven't heard that follow-up story, but I can just imagine, because it just makes me well up inside to think that somebody was living in a state that they felt, there's no way I can fix this now that the vacuum cleaner's broke. I guess it's just a matter of time and everything will be broken and my life's done. That's just it. I see it all falling apart.
That's
to see it turn around to say, I've got hope. And I could get back to something better than where I'm at now, when I was just hoping to hang on as long as I could because I know where this is going. And now you see hope returned to that person.
Yeah,
and it's hard to put a price on what that does to your morale, to say that's really making a difference.
Yeah, and that's the reason why we're in the fire service, helping people out. And you hear a story like that, it's a successful program. I mean, that's exactly what we've got going on here, it sounds like. And I think that's fantastic. Amy, when you walked into Moorhead, I know all about Moorhead, so I'm guessing you had some problems, but did you have any roadblocks when you came into a new community like that?
Thankfully, I've been up in West Fargo and I knew Jeff and I'd done a little bit of background on it. The only roadblock that I had, quite frankly, was just really having the access to, the 911 call reports. But other than that, no roadblocks, because people in the community have seen what we've done in West Fargo. They've seen some of the crossover cases, because some of our Community Health Alliance are located in Moorhead. And so once we said we were coming, then they were like, oh, okay. So it was easy for me to come into this community and on that first call, be able to look at it and call this person's, you got to remember, part of the reason too, when we do these calls, and I said about getting that care team together, this first caller that we dealt with when I was up with you guys, she had a whole care team around her, but they were all vertically integrated. No one was talking to each other. And all I had to do was pick up the phone and say, okay, I'm up here. This is Moorhead Fire Community Health Alliance. We're doing this. And now this is on your responsibility list. This is this. I'm going to be leaving in 24 hours. I need this coordinated, and this is where we are. So now the flip side of this story is I connected with the caseworker and she agreed, and your community member agreed that maybe this isn't the best place for me. Now that I do have hope, I really want to take my animals, and I'm okay now to go to an assisted living and not be afraid to ask for more, because I deserve more. And I have caddy waivers and I have this. And if the fire department cares enough about me, then you know what? I'm going to start returning some of these calls and I'm going to start caring about myself. And she's going to be moving into a new site that is ground level. She'll be able to plant flowers off of her patio, and she is beyond excited. She's left me a plethora of messages, all because of the fire department and that one call that we took in when we were in that class.
Wow.
I think we have, I can tell you that after doing it as long as we've been doing it, there's 1,000 stories like that. 1,000 stories like that in St. Louis Park. And that's incredible.
That was just a training class.
And for people listening, not familiar with the details either, it's not that she was living in a bad place either, per se, but she was living in what might be a more typical public housing type of block building high rise. And she had her own little residential unit she was in, which served the basic needs, but didn't have access to services like she would need, or the access to be outside. And I have to imagine, I've heard this story too from others, I'm guessing it was the case here, that she was also probably afraid to even talk about her situation because she felt that she would lose what little control she had left over her life. Decisions would be made for her instead of with her. And she would lose even the independent living in that public housing type building she was in. But instead and I'm hearing this for the first time from you, so instead she's helping to make the decisions about where she's going. She is going to a different care facility, which, if it had been suggested to her before, probably would have felt like a punishment, that this is being taken away now. I won't have any choice. You're putting me in a home. But it's not a home. It's assisted living where she can get better care, still be independent, have these outside opportunities you're talking about. have other people she'd probably feel more comfortable talking to and socializing with than in the building she was in, and feel like it's okay to talk about what I need, instead of being afraid that if I mention it, a caseworker is going to be here and they're going to cart me off somewhere worse and I won't have any say.
Right. And a lot of these,
yeah,
it's true. And a lot of folks don't understand that where you see some of these buildings, and for folks that have caseworkers, there's a fear there. And they don't know what they don't know. So they don't know how to ask. And when you have a caseworker, that caseworker, they're the ones that are the gatekeeper of the cares and services that you get. So if you don't have somebody advocating and communicating back to that caseworker, they don't know. And many times, because since COVID, the caseworkers are still behind and they haven't done home visits like they should be doing once a year. And so everything's done by telephone. And so had that caseworker been able to go into that house, they would have seen this. But like you said, if you would have asked her earlier on, and when I spoke with the caseworker, she said no, she absolutely did not want to go. And she's actually paying she's paying the same amount in a building that services are being provided for her in an assisted living care plan that's technically independent living, where she can go to an assisted living and have a higher level of care and keep all of her monies and have so much more options and choices. But until someone was able to explain that to her, she didn't know. And she didn't trust anybody to talk to her until Mike and I came in, and she was able to, the fire department was there to tell her it was okay to tell her story.
Amy, most of us have probably been on medical calls where, for old people like me, maybe not old enough like you, Steve, to be watching Marcus Welby, MD. I caught the reference, by the way. You guys probably didn't get. I was watching that before I switched to Murder, She Wrote. So we've probably all been out on medical calls where you've always wondered, hey, what happened to patient so-and-so after the call? And 20 years ago, if you weren't transporting yourself and you had a private provider, you might have been able to find out. But things are so locked down because of HIPAA things and so forth, that once you leave the scene, that's pretty much the last you'll ever find out about somebody. How the heck do you get around all of that stuff to go from not only getting updates, but to be managing care? Because fire departments can't do that. We're not doctors and we're not nurses. So how does that even happen?
That is my favorite question. Thank you for asking, Jeff.
You're welcome.
HIPAA, which is everyone's biggest fear when we're talking about the Community Health Alliance. Because we are working in a 911 call environment that comes to the fire department, and you are working in this Community Health Alliance model with the care team, everything that's being done is done through a HIPAA compliant way. Everything that is being shared has been consented each and every step of the way by the patient, and including the updates is consented back to the patient. The patient says, it's okay for me to do this. So what we're able to provide is, by that consent and by that trust within the fire department, we are a part of the care team. And it starts with the fire department. We're connecting everything back. So when it comes to those updates and comes to, this is what's happening next, because we're part of the care team and I'm in that patient's record and we're working together in an alliance, I am able to say this patient is now connected to services. This patient is now connected to, so then the crews can go home going, oh, finally somebody's stepping in, instead of wondering what happened.
That's great. Chief and Amy, Craig and I work in a department that's smack dab between Moorhead and West Fargo. Do you recommend we just ship people out to Moorhead and West Fargo, or should we give you a call and look at setting up our own program? And if that's the case, how would we get a hold of you guys?
Yeah, just give me a call. Jeff can give you my contact information. And I'm more than happy.
How about for the listeners, if they could?
Oh, for sure. Yeah. Feel free to reach out to myself. Feel free to reach out to Chief Koering. Between the two of us, we'll be able to connect you to where you need to go.
Yeah, a lot of times, we work pretty good as a team, and a lot of the things that have to do with the fire department, the fire chief, the elected officials, the city managers, that group of stakeholders are very, very big part of the decision-making process, but that's the circles that I can help clear some of the stuff. So I can have my union president call your union president. I have my city manager call your city manager. Our mayor call the mayor. It's just a way of clearing the decks. And then Amy is really there to help bring some level of comfort about how this toolkit makes it easy to assimilate into the program. So we kind of hit it from all sides, but only where you ask us to help. And then we offer that support whenever you need it.
Great.
If they're looking for a website, what should they be putting this in the magic Google search box?
You're going to want to look up Care Resource Connections with the S.org.
Perfect.
Nice. Okay.
You can go listen to the numerous podcasts that we have. You can just.
This is correct.
Yeah, we were just going to mention that. You have your podcast yourself. Do you want to spotlight it?
Yeah, so we have. So Amy and I decided to kind of, because it's so new and unique, we decided to start a podcast. We've been fortunate to have Jeff on our podcast a couple times actually, and so yeah, it's just the Community Health Alliance podcast. You can find it wherever you search for your podcast. We tend to download it right onto Spotify, so
sure.
You can check it out there.
I have one quick question here.
Yeah.
I assume there's a cost to this. Can you speak to that at all? How that works, or
Absolutely.
what it would cost the department?
Yep. So very, very, it's super simple. So to the Community Health Alliance toolkit that has all the tools and everything that you need to implement this program has been put together in a train the trainer model. And so that kit itself is $5,000. And because I'm a qualified instructor with the Minnesota Fire Board, that training is reimbursable. So there's that, right? So then you have your kit with everything in it. And then when it comes to the consulting and putting all this stuff together and working on your referrals, it's simple math. It's $1 per 911 call. That's it.
Wow.
Okay.
Sounds good.
And of course, it can work in a couple different models about how much support you have from within the fire department to help with doing referrals, or how much is done through Care Resource Connections. So it can
each and
work
every
a couple
one's
different
different. But the training module is, if you just want to start with training, I would recommend that. And then seeing if you have somebody as a point person to do for the referrals. If you have those things, then we can work out the rest of it. But every community is unique. So I just kind of put out, like I said, the training, $1 a 911 call, and all the rest, like Jeff said, we work with your community and how you guys can implement this program.
The beauty of the most important secret sauce to this conversation is really how you take a local unit of government, i.e. fire department, and you partner with a nonprofit. The nonprofit's capacity and capability to get and go after a grant funding and to operate differently in that space than a local unit of government is critical. Local units of government have a hard time applying for grants or being awarded grants. And so by having this alliance, this partnership, it really gives you the strength to be able to look for alternative ways to move some of these unique parts of the project forward. Including but not limited to staffing, temporary staffing, volunteer workforces, things like that. Things you can't access as a local unit of government, but you can because you've partnered with Care Resource Connections through the Alliance to move this forward.
And I know for Moorhead, I mean, we're really getting our feet wet now with it, just getting started and working through those reporting things to get the data back to you that you need out of our records management system. It's great trying to figure out how to make CAD spit out the information you want back. You folks are on fire records to get the information out. But at least in Moorhead, we have a long-term vision too, in that we're part of a metro area here, but it turns very rural very fast outside of our city borders. And we've got a county fire association between our paid on call departments and our city department here. And if we can be successful in Moorhead, how can we expand that beyond the city of Moorhead? And the nonprofit can help with that, in that as we learn what to do, we could probably bring this service to others that smaller agencies that are completely paid on call might have a hard time doing. Because I think the goal is doesn't everybody deserve this type of care coordination that is almost there and is almost fully funded to do that, but just falls a little bit short of making such a huge difference. And the number of people that are going to be impacted by this over the next 10 to 20 years is going to be huge as we get that boomer wave that goes through, and a lot of people that would really benefit from this type of care. Not me. I'm significantly younger than that, Steve. I don't know if it shows. I don't try to show this side to the camera, but
no, Steve and I, we are committed to reduce any financial barriers that are there to ensure that every fire department has access to this, because we believe in this Community Health Alliance. And the more that we have working in the same model, because it's very important to keep the integrity of the model that we've designed. And so the more we can get the training out there, the more we continue to pay it forward with those smaller and rural departments that really, they're struggling with so many different things. And we just need to make sure that they have the tools that they need to start something like this.
Are you just focused on the Midwest area, or are you willing to go all over the country to start a program?
The hope is the country. We've got
Hawaii or something.
That's where we will retire with our umbrella drinks. That's the plan.
Yeah,
we've had the good fortune of speaking at conferences, California, in Florida, Las Vegas. We just, and a lot of people hear our story and are interested in it, and they've reached back to us and follow. So it's kind of getting that first pebble in the, throwing that first pebble into the pond, so to speak. And
sure,
I think the more and more we get out to these conferences and share kind of what's the update and what we're doing, I think it's going to be an easy step for a lot of organizations to do in their state.
Yeah.
Great. Any last plugs or anything that you want to get in before we just thank you for your time tonight?
Yeah, I would just add that I was on a hospital systems call today where they were talking about the need for rural and resources, and how they're all just kind of, treading in water and trying to survive in some of these spaces. And so the more we can impact with this program in rural, the more we have public health support that can meet us in the middle with that community health.
Right.
I would say that, Jeff, if you listen to what's happening at the legislature, whether it's the EMS task force that's being led by both sides of both Senate and House, and you also have the Meds task force, which is looking at how to reimagine the sustainability of EMS in the state of Minnesota. Right now, Greater Minnesota and the struggles of ambulance are real. And we need to do something that's going to reduce the amount of times an ambulance is required. And I think both the Senator Becker and Representative Hewitt are both looking at this and saying we need to create innovation zones within these areas of problem. And they're looking at our program, the Community Health Alliance, as a solution that should be duplicated across the state. So thank you for having the courage to step up before it became fashionable. And we look forward to you, being a real kind of lamplight on the northwest side of Minnesota to get more departments involved.
Great. Thank you. Appreciate that. And I'd like to thank both of you for coming on the podcast tonight. Our 3 listeners are going to be thrilled to have heard you tonight.
We just doubled our audience size. Woohoo! No, that'd be good.
All right. And hey, if you wouldn't mind just kind of hanging on in the background here while we wrap the show
absolutely.
up, we'll talk to you offline here as well, too. Steve Koering is the chief of the St. Louis Park Fire Department and co-founder of the Community Health Alliance. And Amy Lucht is the founder of Care Resource Connections with an S.com. Look there for more information, co-founder of the Community Health Alliance. So, Craig, I see you got a nice sheet in front of you.
I do, conveniently.
Oh, great. What does it say?
It says FDIC International.
That's it? I see more things printed on there.
Well, I don't have my readers on.
Oh. Welcome to that club. FDIC is just around the corner, April 15th through the 20th, and there's still time to get registered. And they've got all sorts of packages for those folks who are looking for several different classroom opportunities. If you're looking for hot training evolutions to get some hands-on training, or if you're just looking to attend what I think is the best trade show in the country in the fire service, you can simply attend and check out the trade show as well too. But there's still plenty of time to get registered. And our old tagline has been, if you're in the fire service, what do you have to do at least once in your career?
You need to go to FDIC for sure.
Absolutely.
And I got 10 other things you should do, but FDIC is one of the best conferences out there. Looks like they're going to have 800 exhibitors, 250 speakers. That's crazy. All in one place?
Yeah.
That's awesome.
Yeah. All at the Indiana Convention Center and the Lucas Oil Stadium.
Yeah. Beautiful, beautiful location.
Mm-hmm.
They do a great job. I think everyone should get out there. Then they got something, Fire Station of the Future or something. What's that all about, Jeff?
Yeah, so on one of the display floors, they're going to have a mock fire station set up this year with several different vendors showing their products, from station alerting to other enhancements for your fire station living in that facility, so you can see what a fire station in the future might look like. I've got these visions of the Walt Disney World of the Future back at Disney World in the 1960s. So I'm sure they're going to have flying fire trucks that will be solar and hydrogen powered and all that kind of stuff. None of that.
Everybody needs to get out. Everybody should get out there once in their life, once in their career, if not more.
Absolutely.
Recommended more.
They estimated last year they had more than 34,000 people attend FDIC, and that's the people there outside of who are all the other folks that are in Indianapolis at the time. It's quite an endeavor to get everybody housed and transported and all that kind of stuff, and to think you've got an entire city full of fire folks that are gathered together to just learn and grow, talk to each other, make connections, find out what's out there, and grab things to bring back home to spur innovation, conversation, and discussion and stuff.
Absolutely.
Yeah, it's fabulous.
April 15th through the 20th, 2024. Get out there.
There you go. And if you're looking for more information and you're finding a lot of banking information, you're at the wrong site. Dry humor FDIC joke. Very good. Last reminder before we sign off, that new schedule for those of you who chose to stick around till the very end, starting next month, we will always be on the third Friday of the month, at least for the foreseeable future. So you can plan on that. Again, you can set that up to download the podcasts pretty regularly in your broadcast feeder like Spotify or wherever you get them. You won't be getting them at Google Podcasts anymore because they're discontinuing here at the beginning of April. It's my geek moment. And you can check us out on YouTube if you haven't done that already to see what we look like in person. And I can tell you, I don't know if we sound better than we look, but I'm not sure that the whole package comes together in any way, shape, or form.
It's shocking.
Yes.
That's all I can say.
Tune in just for the shock value, if nothing else. See what happens here in the studios. All right. Thanks for taking the time to just try to learn and grow in the fire service. Be safe, be well. We'll see you next month.
Have a good one.
Be safe.
Thank you for listening to Tailboard Talk. Don't forget to tune in each week, Monday through Friday, 5:30 p.m. Eastern, 8:30 p.m. Pacific for Fire Engineering Talk Radio. You can also subscribe to all of our shows on iTunes. Just search for Fire Engineering Talk Radio. Check out our educational programs and consultation services. They're all available at tailboardconsulting.com. There you can find links to all of our shows and our magazine articles. Thanks for listening, and join us again next month for another episode of Tailboard Talk on Fire Engineering Talk Radio.